Good morning, folks, or good afternoon, or good night, or whenever you get to watch this. I hope this video finds you all doing well, health-wise, business-wise, spiritual-wise, all kinds of wise. Here, trying to make my second video here, see if I can say and pause a lot less, and or look away from the camera a little bit less. Hopefully, we'll see. It's all work in progress, but today I'm just gonna share another case with you, and maybe add some more factors and discuss some more things that have helped me, and hopefully I'm trying to keep employing more so it keeps helping me and hopefully can help you. So first I'm going to discuss the case that we're asked to share here. Guess what? I have another headache or head case. Not like they're crazy, but in terms of migraine pain today. So one of my patients that, not at my job with the workers' comp, but at my other more private clinic job, which I actually had to let go recently. It's a good case, but it involves a early 50s lady who her complaint was really severe migraines, and not just headaches. I'm sorry, I said headaches earlier, but she was suffering from straight migraines. I remember her first day, she'd have bruising along her, her right side here, like around GB14, around this area. There'd be bruising in this area, not because of the migraine or any trauma that struck her, but because her head hurt so much, she'd have to keep her fingers at these points so hard just to take the edge off. And it was pretty intense to see this lady walk in. She had acupuncture before, but she told me that she used to get electrostim in her head for her headaches, and that kind of blew me away. That was kind of like, we hear the analogy, why would you slap a crying baby? Seemed to be that's what she was getting before, and so obviously she didn't believe that style of acupuncture was for her, and hopefully I was hopefully going to offer her something different, which, as we know, using the balance method, that we can. Yay, happy day. So we gave her treatment, obviously. I don't know if this is the video to discuss what we did, maybe not, but for the most part, the first couple of months we saw her twice a week, or or 1.5, we'll say, just to make it things. So for the first 2 months, she felt like on the table, as we were supposed to, I guess, on the table, that this was different, and she was feeling some relief. Her headaches or her migraines would come back, but then it would definitely not be as sharp, not as intense. She'd hold her head a lot less. She was able to not be bruised up there anymore, and be looked upon by people that maybe she was being abused or something. She had a lot less of that, even in the first 2 months. So, being impressed by this, she decided to continue. After the first 2 months, she made it a staple of her life to receive acupuncture once a week, because this is what she could do. And I would say I agree that was okay, because the fact that she was actually getting better. She was actually smiling and laughing with me. We were telling jokes. We would actually talk about what's going on in my life personally, not too far obviously. And then I'd ask what she does, and she at first didn't look like a person who would be willing to share because of all of her pain, but she started transforming for sure. So I don't have specific dates, but I can say that for the last 3 years, she's one of my regulars. She's a staple of my schedule at this other clinic, and she would, for the most part, just be on the schedule. So if she did the math, it's like she was once a week for 3 years. We'll just, obviously there's misses here and there because of my schedule and her schedule. So that's like, let's say 52 weeks in a year. So that's how many? 52 treatments a year times 3 years. That's about 150, right? Or 156. So I did the math and times that by 65, which is I'm rounding that to my follow-up rate. It turned out to, in the past 3 years, she's invested about, hold on, let me check it. I